My name is Pasquale Giordano. I'm a consultant surgeon and colorectal surgeon at Barts Health, which includes the Royal London Hospital and Whipps Cross Hospital, where I've been in that position for 24 years. I'm also an honorary senior lecturer at Queen Mary University College. Since I was a little kid, I always find very, very interesting biology, chemistry, all those science, and the interest in how life develop and how things go wrong along life. So I always had a bit of a passion in that direction. And as grown up, I really found that medicine was what I really wanted to do. To understand a little bit better the beauty of life, but also to have the opportunity to help people suffering around me. And that is a unique profession which offered you a lot of options, like studying, researching, being deeply involved in science, as well as playing an active role in helping others. So I think the combination of all those things is something that really I was attracted to, and I still enjoy nowadays after many years. This is a kind of a natural path I followed all the way along. I enjoyed every single bit of my medical training, every specialty of every kind. But I always thought surgery is that type of specialty which allow you to directly make a difference to your patient rather than prescribe a drug, which we do by all means, interfering directly with your ends and making the patient better. I thought was something especially unique, and I really enjoy that. And having the opportunity to try to make that better and more special is something that's been the drive of all my professional career. Even today, I still enjoy trying to think how to make a difference to my patients by introducing new concept, new idea, and new techniques in my everyday practice. Colorectal, eventually, as I said, I enjoyed everything, but eventually I went into colorectal because I wanted a specialty that was offered me all of those things. Not that other specialty don't do that, especially within surgery, but the unicity of colorectal surgery was that covers a lot of very common pathology and a lot of very serious conditions. That's starting from bowel cancer, which is one of the most common cancer in the world, affecting both sexes, of course, any age, especially, of course, in the more advanced age, but also functional bowel problems, which may not kill someone like cancer does, but can affect significantly quality of life for the patients. So functional bowel problems, pelvic floor problems, and so on. So at the same time, that is also a specialty that will offer you to do a lot of research, a lot of studies, and match the clinical side to the research side. I think was a perfect combination for me. And looking after common conditions that everywhere in the world you'll have will be something that obviously would be perfect for me. And hence I ended in this specialty. Bear in mind, as I said, I enjoyed and loved everything else I do, and I did, and I still do general surgery, and I also have some subspecialist interests in other areas, a little bit outside colorectal, which are especially abdominal wall surgery. I'm, first of all, very fortunate to do a job that I enjoy, I like, and give me a satisfaction. You know, every day I go to work and I start, of course, there will be problems, there will be challenges, there will be difficulties that we have to overcome every day. But when I get in front of a patient, when I get to talk to a patient, and even more when I am in theater performing my surgery, the reward that I have when I can see that I can fix something, I can prove things, I can make a difference someone, I think is got no comparison. And it's even difficult for me to express that feeling. When I go and see a patient after an operation, the patient I've made a difference, and that is a feeling that is very unique. And today, as my first day in medical school, is still very strong, it still hasn't changed. And I think having the privilege to do something that I really enjoy and is really rewarding, and not often, and not always, but fortunately most of the times make a difference in a positive way to our patients, is a very unique thing, and is something that I really enjoy and I appreciate. I believe, based on the feedback that I receive from my patients, but also from other member staff working with me, such as nurses, junior doctors, and secretaries, everyone, one of the things that come up most of the times is the ability to engage with the patient, the ability to listen to the patient, the ability to give them the opportunity to express themselves and explain what the problem is, dedicating the right amount of time to each individual patient and treating each individual patient as such, I think is a quite unique thing that we should be doing naturally, but I suspect not everyone always does that. And I think it's a very important thing. And that is one of the most common comment I get from the feedback from patients and other people around me working with me as part of my team. I think respecting them is the best way to gain respect back. And I think this is one of the best thing I managed to do. Of course, providing successfully a service and successful outcome to the patient is key in this thing. And that is also something I think is very important. And of course, fortunately appreciated by patients. What I value most about my patient is the opportunity to listen to them, to understand, or at least try to understand what the actual problem is, and try to understand what I can do for them. But the other thing is and I probably already mentioned this earlier, when the patient say thank you after we've done something, that is an invaluable feeling that really make me feel special at that moment. And I think that is the most important thing. The thing that I appreciate most and I value most about my patient is seeing doing well after I've done something for them. One thing that I often use in my practice, and that is directly linked to the nature of the job I do, which involves taking care of patients with a lot of complex problem, especially of functional nature, or extremely complex abdominal wall hernia. And these are conditions that very few specialists would treat. These are conditions considered benign. As benign means they are unlikely they're going to kill you, although sometimes, occasionally, complications of this condition may lead to even life-threatening situations. But most of the time, these are functional problems that interfere with everyday life, having a massive impact on the patient's quality of life. And they may not kill the patient, but may make that life terrible. And one of the frequent expression I use in my practice is I understand exactly what you mean. I understand this is a condition that is not going to kill you, but it's going to make your life miserable forever. And that's why I'm here for you, trying to do whatever I can to help you. I think that expression condense a lot of meanings. I think that expression try to put you at the same level of the patient, because I don't have that problem, but I see a lot of those problems. So although I don't suffer specifically those symptoms, I understand the way those symptoms can impact on the person in front of me at that moment. And I understand the consequences of that problem, even if I don't live those directly myself. So I think that I try to put myself the same level of the patient in front of me, and make sure that they feel comfortable and are sure that I am there to help them.